Arlene asks, how do you propose to fix healthcare, and do you believe in universal healthcare?
Where's Arlene? Arlene, that is the number one question on people's minds in our district. We know that Chris Smith eroded the ACA over 10 times. He chipped away at it. We know that Chris Smith was part of the leadership. I mean, I don't know, guys, I don't want to be too anti-Chris Smith, but he's been in office 38 years. He should be Speaker of the House. He should be a senator, or I think he should have moved on by now. And when bad things happen to our state, whether it's the tax plan that's hurting most middle-class families that have helped the rich, the top 5% stay richer in America, and this relates to healthcare because on that tax plan in December, 13 million people lost healthcare. And when 13 million people get off the exchange, your premiums go up. Our premiums go up. My wife pays for insurance on our family, and her premiums have gone up. And we're going to see it worse in 2019. So when these things happen, we need to hold Chris Smith accountable, and Paul Ryan, and Mitch McConnell, and every other Republican that has nearsighted vision that hurts us, that helps us today, maybe with a small tax cut, but it's going to hurt Social Security. It's going to hurt Medicare. It's going to hurt Medicaid. These are fundamentals. These are a social contract in America. So I believe if you want to fix universal health care, if you want to move to that system, it's a combination of either moving beyond the ACA and making it more inclusive and affordable. It could take a form of there's debates around Medicare for all or single pay or a public option. My commitment is to work side by side every delegation member of New Jersey and many Republicans, because this is now something we agree on broadly as Americans. Over 40% of Americans now are saying they want universal health care. When we get universal health care, the first thing we have to do is lower the cost of pharmaceuticals.
Yeah.
We're paying $600. We have residents in Ocean Township paying $600 for heart disease medicine. That's 17 pills. We have people that stop at Walgreens and CVS and Walmart to shop for the lowest cost pharmaceutical drugs. So when we get buying power, when we aggregate demand, and we can bring down the cost of pharmaceuticals. There's too much administration in the U.S. healthcare system. Insurance companies that own politicians that have all that money going into long-time career politicians like Chris Smith. You know the majority of Chris Smith's funding comes from corporations. Our campaign takes zero corporate PAC money. So I am beholden to your voices and your votes, and making sure we get rid of the administration burden is so important in the healthcare space. I also want to take care of our veterans. As a veteran myself, who's is talking side by side other VFWs here, veteran care is not where it needs to be. And we have veterans that are in long lines. We have veterans that are getting very little access to care. Our Vietnam vets, our post 9/11 vets. And another piece of healthcare is to use some of the model we see in the DoD, in the Department of Defense, and translate that into some of our services for everyday families. So those are my key priorities if I think about universal healthcare. Thank you.